ठीक है सर, तो बिस्मिल्लाहिर्रहमानिर्रहीम। आपने केस तो नहीं लिया, अगर प्रेजेंटेशन होती तो आप कर लेते। सो मोस्ट ऑफ द केसेस यू विल फाइंड विद द डिस्टेंशन ऑफ एब्डोमेन। ठीक है, तो एनी पेशेंट हैविंग कंप्लेन ऑफ द डिस्टेंशन ऑफ एब्डोमेन, तो आपको क्या करना पड़ेगा, आपको सबसे पहले डिफरेंशियल डायग्नोसिस आनी चाहिए। व्हाट रीजन बिहाइंड द डिस्टेंशन ऑफ एब्डोमेन, क्या हो सकता है रीजंस? एक तो फ्लूइड, फैट, फीटस, फुल फ्लेडर, ठीक है ना, फीसिस, ये हो सकता है। मगर कॉमन हमारे पास जो रीजन है वो फ्लूइड ज़्यादा है, ठीक है ना, असाइटीज जिसको बोलते हैं। और व्हाट इज असाइटीज? एबनॉर्मल और पैथोलॉजिकल accumulation of the fluid inside the peritoneal cavity. It may be normal. Normal is about 20 ml, especially in the females during menstruation. It may be normal, but clinically it become 150 ml. It can be detectable on examination. So कम से कम 150 ml से ज़्यादा होना चाहिए जब आपको clinically पता चलेगा patient have the distension. So the common reason of distension abdomen is cirrhosis of liver with portal hypertension. This is very common reason of ascites, 80% cases. If anybody asks you what reason of the ascites of आपने कहा the cirrhosis of liver with portal hypertension, it means you are the 80% right. You are the 80% correct. This is a common reason. So the patient usually have the adults, male or female, came in the ward with complaint of the distension of abdomen for suppose 3 months. यहाँ आप हिस्ट्री लिखें, patient abdominal distension for 7 days. 7 days से उसने फील किया होगा. It may be 1 month or 2 months. Okay, so whenever having the distension, think about number 1 is a cirrhosis of liver with portal hypertension. This is a common reason. The second common reason is the hepatic congestion, and this hepatic congestion is because of the right heart side failure, constrictive pericarditis, Budd-Chiari syndrome, or venous-occlusive disease. Venous-occlusive disease, and this distension may be because of the infectious, like the TB peritoneum. It may be fungal infections, or it may be malignancies like the peritoneal carcinomatosis, hepatic metastasis. So these are reasons behind the distension. It means this patient is 25 years old, female, 45 years female, came from the Candiaro, admitted in this ward with complaint of the distension of abdomen for 1 month actually. So it means it may be ascites, it may be other reasons. So you will start the history of present is a known case of the hepatitis C. She is a known case of hepatitis C. According to my patient, she was in a usual state of health 7 days back. यहाँ पे क्या लिखना है आपको? My patient is a known case of chronic hepatitis C. Then आप open करेंगे. Then she noticed abdominal distension, which is increased gradually. So whenever there is fluid, first of all क्या होगा? There will be flank distension. So start from here, from the flanks. So patient usually start the flank fullness, and sometimes he didn't notice any distension. He say it may be because of gases, it may be because increase taking the meal, and sometimes the other friends, other family members notice your pain is abdomen distended. So what's happening with you? Sometimes patients sometimes ignoring his or conditions, and other people saying you have the distended abdomen. What is the reason behind? Sometimes patient came, I don't know what is happening with me, but my husband, my relative told me your abdomen is distended. So this is very important, how she are noticed. So initially usually it start from the flank and slowly and gradually involve the whole abdomen. So this is usually a analysis. First part is analysis with gradual onset. So distension abdomen, my patient was hepatitis C, treated case of the hepatitis C. She noticed the distension abdomen for 1 month. Initially it starts from the phalanx and slowly and gradually involve the whole abdomen. Now your mind should be clear, exclude the important positives and negatives. My patient had no history of the fever at that time. My patient had no pain, colky pain, vomiting or constipation at that time. It means you are excluding the other inflammatory causes or intestinal obstruction. Fever means no fever, my patient, you exclude the other infective causes. My patient have the no swelling below eyes or urinary complaints. It means you exclude the kidneys. My patient has no chest pain, orthopenia or PND. It means you are excluding the heart failure. But my patient is a treated case of the Hep C. Now it means you are linked with the cirrhosis of liver. Suppose you have done an history of the Hep C, then what you will be plain? They ask about the risk factors for the hepatitis C or B. What they are? Number one, blood transfusion. Number two, past history, we go for the past surgical history. Number three, family history of the Hep B and C. Number four, viral. Number four, tattooing, any marking. Number five, nose and ear piercing. With the male, then ask about the barber shave, tooth extraction from a dentist. Then the religion, especially the mourning, जो mourning करते हैं, ठीक है ना, शियाज़ा, उसमें भी रीज़न हो सकता है. Then traveling abroad, sexual history. These are the risks for the viral hepatitis. If the patient had any history, then ask about the risk factors for the viral hepatitis. So this is your third para. What is the reason behind the this cirrhosis or ascites? What is the reason behind this liver disease? If you are suspecting, if the patient has no any criteria, no any risk factors, then ask about other factors like क्या पूछेंगे फिर आप? Color change of the body, it's because of hemochromatosis. Behavior changes, psychotic disorder, tremors, this is occur in the Wilson disease. Any acne, menstrual irregularities, hirsutism, this occur autoimmune liver disease. So ask about these symptoms. What is the reason behind this? So this is the history. It means you are going for the cause. If you are satisfied and patient has no issue, then you go for the investigations. So this should be in the all in the your history taking. Then the patient in the ascites, it means most probably Hep C is positive. Ask about the other complications. Having history of the upper GI bleed, any blood in the vomiting, ask about my patient has no history of blood in the vomiting. My patient denied the symptom of the black color stool. My patient denied any symptom of the altered level of consciousness. Yeah, means you are excluding hepatic encephalopathy, upper GI bleeding, or through the hematopoiesis or the melena. It means the patient is only complaint of the digestion, no other finding a symptom of the portal hypertension. उसके बाद then treatment outcome. उसके बाद इसकी Hep C positive, ask about the Hep C. How she was diagnosed, when she was diagnosed, what investigation was did, how she was treated with either injectable therapy or non-injectable therapy. Did she complete the therapy or not? Because most of the Hep C is treated by the antiviral therapy, but at that time we didn't see the status of the liver with fibroscan or ultrasound, because most of the patients are already having the fibrosis 2 or 3 and they become in the future will develop the hepatocellular carcinoma or cirrhosis of liver if she is treated. So should see that she was treated or untreated case. Then systemic inquiry. उसके बाद आप आ जाएं पास ड्रग हिस्ट्री, any allergic history, any Hakim, because most of the drug patients taking the Hakim's drugs. So ask about the homeopathic, allopathic drugs or use of Hakim drugs. उसके बाद अब आ जाएं family history. Ask about the family history of these viruses, cirrhosis or hepatocellular carcinoma. उसके बाद family history में क्या पूछेंगे अब? Other family members, because here this is not only patient, but here you treat the family, because Hep C is positive in her family member. You should have to exclude other family for advice क्या करना है? Screening करना नहीं. Other family members should be advised Hep C and Hep B screening. If they are positive, you should treat them, because otherwise they will also treat the ultimate result the portal hypertension or cirrhosis. So it means if she is married, go for the husband test, because there is a sexual relationship. Number one, his children, kids, and all the family members should be screened out. This is important here. Family history is very important. उसके बाद menstruation history, because she is a female. History of blood transfusion, already told you risk factors. Ask about the blood transfusion. Past medical and surgical history is very important. To past surgery, number one, past any minor surgery like tooth extraction, was ask please. This is very important risk factors. Then ask about the blood transfusion. This is very important. Now the socio-economic history. The socio-economic history is also important. Why? What you will ask about socio-economic history? Number one is the diet. Sometimes if the patient is no risk factor for the viral, you exclude all the hemochromatosis, Wilson disease, autoimmune. Sometimes patient may have the hypoalbuminemia, and this hypoalbuminemia may be because of the nutritional. So ask about the meat and fish intake, because hypoalbuminemia may result the generalized edema or ascites. So nutrition is very important. Then ask about the any dietary factors, inhibitors. Sometimes these patients didn't take the eggs, they didn't take the fish, they didn't take the chickens. Why? They say they are the garam, and we have the liver disease. Say all they sometimes the घर वाले रिस्ट्रिक्ट कर लेते हैं, ये भी नहीं खाओ, ये भी नहीं खाओ, ये भी नहीं खाओ. So ask about the intake of the fish, meat and eggs, and ask about the salt intake, because here ascites, patient with ascites, salt intake is very important, because management start from the salt restriction. So dietary history is very important in this patient. If you didn't ask about the ventilation, about the rooms, no problem, because this is not relevant to case. But the patient you are suspecting the tuberculosis, then this is very important. So this is very important history in this patient. Then go for the examination. Examination means general physical examination. Your patient female, lying comfortably in the abdomen with the distant abdomen, having cannula placed on the right arm. उसके बाद शी इज़ कोऑपरेटिव, वेल टाइम स्पेस पर्सन. उसके बाद देन जनरल फिजिकल में आपका वाइटल्स, और उसके बाद हेड टू एग्जामिनेशन. क्या करेंगे हेड टू एग्जामिनेशन में? आपको मेन इंपॉर्टेंट क्या चीज़ है? एनीमिया, सर जॉन्डिस, साइनोसोइड डेवलपमेंट. उसके बाद साइंस ऑफ पोर्टल हाइपरटेंशन, वो कौन सी है जी? यहाँ से स्टार्ट करें. पामर एडिमा, ठीक है. व्हाट इज पामर एडिमा? रेडनेस ऑफ द थिन आर एंड हाइपोथिन आर. दिस इज कॉल्ड एज अ पामर एडिमा. व्हाट अदर कंडीशंस विल लीड टू द पामर एडिमा? वो तो हो गया पोर्टल हाइपरटेंशन नंबर वन. प्रेगनेंसी, इसके अलावा थायरोटॉक्सिकोसिस, इसके अलावा सीओपीडी, इसके अलावा रूमेटॉइड आर्थराइटिस. In these conditions, you may also find the palmar edema. So palmar edema is not specific for the portal hypertension. This may occur in the non-portal hypertension condition too. Then in the hands, what else? Depotent contractures. The depotent contractures क्या होते हैं? This is a thickening of the fascia, and that's why due to thickening you will find the flexion of the ring. फिंगर्स, ऐसे हो जाएगा या ऐसे हो जाएगा. And this is because of thickening of the fascia, and this is a depotine contractures, and depotine contractures also occur in the portal hypertension. Other causes क्या हो सकते हैं? Manual workers, उनमें हो सकता है. Diabetes is a common reason for depotine contractures. उसके बाद आ जाएं nails में. Nails में you may find the leukonakia. Leukonakia is a whitening of the nails, and this is occur because of the hypoalbuminemia. What else? Clubbing. The clubbing occur which sources? Not all cirrhotic patients is clubbing, but one specific reason cirrhosis will result the clubbing. Which one? Primary biliary cirrhosis. So primary biliary cirrhosis you will find the clubbing. उसके बाद यहीं पे stop traffic sign. This is a flapping tremors. He cannot hold the fingers. क्या होगा? Down होगा. This is flapping tremors. या hepatic staxis. So this is occur in case of the hepatic encephalopathy. उसके बाद यहाँ पे आ जाए xanthelisma. Xanthelisma also occur in the primary biliary cirrhosis. In the eyes, look for the cave rings in case of the Wilson disease. Cave rings. उसके बाद eyes jaundice clubbing आ गई. Hairs कैसे होगा? Loss of shining हो जाएगी, dry हो जाएंगे, alopecia हो सकती है. Then face में parotid gland enlargement या parotid enlargement. This is occur in the alcoholic cirrhosis. Parotid enlargement, alcoholic. Then neck examination, there will be no JVP. If you find the JVP with ascites, think about the cardiac conditions. Then you go for the thyroid examination because Hep C also associated with the thyrotoxicosis or hypothyroidism. Then in the chest, you go for the spider nevi. What are the spider nevi? They are the reddish color skin fading papules होते हैं, and this is disappear up after the pressure. Less than 2 or 3 are the normal. Maybe occur the pregnancy, but more than 3 are over the chest as abnormal, and this is also occur in the portal hypertension. Then in the breast will be enlarged, gynecomastia in case of the males. In case of females, breast atrophy. ठीक है, अगेंस्ट होता है breast atrophy in case of females and gynecomastia in case of the males. वो होगा. Then in the legs, you go for the pedal edema or sacral edema. So this is the signs of portal hypertension. You should look for all the patients you are suspecting the cirrhosis of liver. They should be commented the signs of portal hypertension. This is very a good question or a common question asked by the examiners in the final year. Signs of the portal hypertension. So next time I will ask you from the signs of portal hypertension. ये याद कीजिएगा. So this is general physical, and after the examination of the abdomen, you already did the abdominal examination, I think, and for the ascites you will find the distant abdomen, and you may find the fullness of the phalanx. So the distant abdomen आप comment करेंगे on inspection. Due to distension, you usually find the loss of hairs, and the loss of hairs also sign of the portal hypertension. Loss of hair from the chest and abdomen जो normal होते हैं. So you will find the normal loss of hairs. So abdomen becomes shiny, having loss of hairs, and you may find the visible veins, any scar or any puncture when you go for the paracentesis. वो देखना पड़ेगा, and look for the umbilical position. Umbilical position and umbilical margins. So आप बोलेंगे सर my patient's abdomen distended है, Number one, move the respiration equally. This is shiny, no visible marks, scars, visible veins or pigmentation. Umbilicus looks to be centrally placed with umbilical margins are everted. So this is your inspection finding, and the cuff reflex is negative for the hernial orifices, for see the umbilical hernia. Even umbilical hernia or angular hernia is common in these patients. So cuff reflex is negative. उसके बाद palpation. The palpation in ascites is a special form, name is a dipping method. So by going dipping, see the palpatory organs in enlargement. यहाँ भी देखना पड़ेगा dipping method, because आप dipping से क्या करेंगे, फ्लूइड को बाहर फेंकेंगे. इस तरह करते जाएंगे तो उसमें आपको ascites में dipping method करेंगे for the palpation of the organs, either patient splenomegaly or hepatomegaly. उसके बाद go for the percussion, and percussion is very important in case of the ascites. तो सबसे पहले fluid shifting dullness यहाँ से शुरू करेंगे, परकस करते जाएंगे, उसके बाद टर्न करेंगे, उसके बाद करते जाएं, जहाँ पे डल मिले तो वहाँ छोड़ दें आप, फिर पेशेंट की पोजीशन आप चेंज कराएं, अगेन परकस करें. अगर पेशेंट का पहले डल था फिर रेजोनेट हो गया, मीन्स पेशेंट का फ्लूइड शिफ्ट हो गया, अगेन रिपीट करें और साइड भी देख लें आप. तो इसमें मकसद देखिए शिफ्टिंग डलनेस विल बी पॉजिटिव इन केस ऑफ द ascites. व्हाट अबाउट फ्लूइड थिल? फ्लूइड थिल ले वही एक असिस्टेंट ले ले, यहाँ से आपको थोड़ा सा प्रेस करना है, उसके बाद थिल देखने के लिए ये तरीका है. अगर वो भी पॉजिटिव तो इसका मैक्सिमम पेशेंट को सीवियर ascites है. सो बाय द हेल्प ऑफ शिफ्टिंग डलनेस एंड फ्लूइड थिल you can divide the ascites either the mild, moderate or severe. In case of the moderate ascites, there will be only shifting dullness be positive, no fluid thill. This is mild. In case of moderate ascites, shifting dullness and fluid thill both will be positive. But in case of the severe ascites, only fluid thill be positive, but there is no shifting dullness because there is no fluid to find for the shifting. All the cavity is full of the water. So by this way you can divide the ascites mild, moderate, severe clinically. So this is all about the examination a patient with the ascites. Suppose if they find that there is some finding of the cirrhosis, it's okay. Otherwise, for the secondary cause, you look for the temperature, you look for the lymph nodes, especially left supraclavicular region lymph nodes. This is occur in the malignancy. So look for the other findings. What is the reason behind the ascites? Okay, then आपने एग्जामिनेशन किया, आपने सब कुछ कर लिया, आपने फाइनल डायग्नोसिस क्या बनाई आपने? मोस्ट प्रोबेबली माय पेशेंट द ascites secondary to portal hypertension, and this secondary portal hypertension most probably cirrhosis of liver, because a patient is a mild splenomegaly and having the shrinkle liver, because liver spleen was 6 cm, 8 millicurie line. That's why you say my patient is the cirrhosis of liver with portal hypertension with ascites. अब क्या करना है? अब क्या करना है? अगर आ सकता है तो करा ले, ले आए पेशेंट को. यही पेशेंट अगर आ जाए तो अब क्या करना है? इन्वेस्टिगेशन करनी है, कंफर्म करना है. वैसे फाइनली तो कर लिया आपने, देखिए हिस्ट्री में सारा कुछ बता दिया आपने कि मैं पेशेंट साइड, अपने क्या बचा? कुछ नहीं बचा. अब इन्वेस्टिगेशन में क्या होगा? कंफर्म करेंगे आप. तो इन्वेस्टिगेशन सबसे पहले क्या स्टार्ट करेंगे आप बोल सकते सर मे बी बेस लाइन. तो बेस लाइन स्टार्ट करेंगी सीबीसी. सीबीसी में क्या मिलेगा आपको? सीबीसी नहीं है इसकी. So CBC means this is a chronic disease. You may find anemia, you may find the pancytopenia because of hypersplenism, In infection, you may find the leukocytosis. Either leukocytosis may be occur infection or it may be occur in the case of the hepatocellular carcinoma. Then द स्पेशल इन्वेस्टिगेशन में आप क्या करेंगे, आप एक से यूरिन डी आर दिया दी वो कराना है आपको. उसके बाद आशवाग राय साहब जो स्पेसिफिक इन्वेस्टिगेशन है वो आ जाएं, वो है आपका पैरासिंथेसिस, ascitic fluid DR. और ascitic fluid DR में क्या करना है आपको, सबसे पहले कलर देखना है. कलर क्या होगा, नॉर्मल. अगर नॉर्मल है तो स्ट्रॉ कलर मिलेगा, अगर इन्फेक्टेड होगा येलोइश मिलेगा, अगर काइलस होगा तो क्रीमी मिल्क मिलेगी आपको. तो कलर ऑफ फ्लूइड देखना है आपको. उसके बाद साइटोलॉजिकल एग्जामिनेशन करना है. उसमें क्या देखेंगे आप, WBCs. WBCs नॉर्मली लेस देन 500 माइक्रोलीटर से कम होने चाहिए. 500 न्यूट्रोफिल्स 250 से कम होनी चाहिए. अगर से ज़्यादा हैं तो आप लेबल कर सकते हैं SBP, स्पॉन्टेनियस बैक्टीरियल पेरिटोनाइटिस. 250 से ज़्यादा हो तो. उसके बाद द प्रोटीन्स देखनी है आपको, ascitic fluid प्रोटीन्स. तो प्रोटीन्स में क्या मिलेगा, ट्रांसुडेट मिलेगा, 2.5 से कम मिलेगी आपको मिलीग्राम पर डेसीलीटर. मगर 25% केसेस में यू मे फाइंड द नॉर्मल और इंक्रीज प्रोटीन्स इन द ascites इन केस ऑफ द cirrhosis of liver. देन आपको क्या करना है, साग करना है. साग वो क्या होता है, सीरम अल्ब्यूमिन ascitic ग्रेडियंट. आप सीरम अल्ब्यूमिन करेंगी, उसमें से सीरम ascites को माइनस करना है आपको. उसके बाद ग्रेडियंट देखना है. अगर 1.1 मिलीग्राम पर डेसीलीटर है या मोर देन 1.1 मिलीग्राम डेसीलीटर है, इट मीन्स दिस ascites इज ड्यू टू पोर्टल हाइपरटेंशन. अगर लेस देन 1.1 है तो दिस इज अ नॉन पोर्टल हाइपरटेंशन ascites. And the portal hypertension ascites is commonly because of the portal pressure, and this portal pressure is commonly seen in case of the cirrhosis of liver. The other causes of the portal hypertension I already told you. These are the Budd-Chiari syndrome, hepatic congestion, right heart failure, CPC. यहाँ भी या SAAG आपको more than 1.1 या 1.1 से means this is a portal hypertension. And you know the portal hypertension may be pre-hepatic, may be hepatic, may be post-hepatic.